Thank you. Thank you for the opportunity to speak. Hello, my name is Alka Airy, and I'm from San Francisco. I would like to provide a statement opposing the appointments of Dr. Thorpe and Dr. Gananade to the medical board. I'm also speaking on behalf of my sister, Shilpa, who was a research scientist focused on rare genetic diseases in children before a series of horrific and preventable medical errors at 2 hospitals ended her life. Patient safety and physician oversight are central tenets of the medical board, and yet both have been relentlessly weakened by the California Medical Association's lobbying efforts. Appointing another former president of the CNA will only strengthen the CNA's influence over the medical board and hinder much-needed reform. We simply do not need another leader from the CNA on the medical board. If anything, the medical board needs more independent voices, particularly those from the patient advocacy side. I'm not a physician. However, I come from a family of physicians, scientists, and academics, and I have worked as a healthcare investment banker. I understand the challenge of balancing business needs with oversight and how extensive government regulations can cripple an organization or industry. However, I've also seen the ugly side of medicine when an industry fails to police its own and when physicians place their livelihoods over the care of their patients. Unfortunately, through its lobbying efforts to protect physician rights at the expense of patient care, the CNA has blocked reform that would have saved the lives of many patients in California, including my sister. The CNA has blocked all efforts to hold physicians accountable in any meaningful way. The CNA has helped create a climate in California where physician mistakes go unchecked without any consequences. For example, I have encountered physicians manipulating medical records to hide their mistakes. Physicians have demanded I stop asking questions as a prerequisite for an organ transplant listing. I have even been pressured to pull life support without being informed of key test results that confirmed physician negligence. None of this was legal, and yet it still happened. After I lost my sister, I turned to the legal system, but the current medical malpractice law severely restricts access to justice. I then turned to government oversight agencies like the medical board, but then learned how biased and inadequate their investigations really are. The medical board dismissed my complaint without action. The Department of Public Health referred a part of my hospital complaint to the medical board, but I never received a response. Time and time again, through my effort to seek accountability for my sister's death, I have been told that the medical board is beholden to the CNA. By appointing Dr. Thorpe and Dr. Gananade to the medical board, you are cementing the status quo. We need to bring fairness and integrity back into our healthcare system. We need more objective voices on the medical board, and no leader of the CNA, let alone a current trustee, can fulfill that.